Okay, I will start right away, and I'd like to greet you all. Good morning, everyone. My name is Your Happiness Willibrod. I work with WaterAid Tanzania as the head of programs. I'm happy to be with you all here today as we're discussing an important point of why WASH is a vital subject in universal health coverage. And before I invite the panelists, I would like to take you a little bit through the background of WASH and its importance in health, and as well as we link it with universal health coverage. Next, please. So as an introduction, WaterAid Tanzania has been working in the country for over 40 years now, and as an operational office of the UK within East Africa. And at the moment, WaterAid is implementing its new strategy with two main aims. The first one, aiming at attaining sustainable, inclusive, and safe wash services in the target geographical areas. And the second one is really looking at prioritizing WASH across the health sector to improve public health. And the second one is what is linked to the discussion that we are going to have today. Next, please. So I wanted us to look at a bit of a background of WASH and universal health coverage. Globally, the data show that the basic hygiene services are unavailable in almost 50% of the healthcare facilities. And the topic around universal health coverage with WASH is really picking from the World Health Assembly resolutions, which were adopted back in 2019. And they are stressing on the fundamental importance of adequate WASH services in achieving universal health coverage. And if we look at this global perspective of WASH in relation to UHC, it gives an emphasis on the crucial role of clean water, sanitation, and hygiene in promoting health. And as we promote health, we end up in achieving, or we contribute in the achievement of universal health coverage. Next, please. A little background, sorry. A little background about the situation in Tanzania, and these are data collected from different studies, some done internally by WaterAid, but also, like the picture is globally, also our facilities, like over half of them, they lack piped water supply. And we all agree that at least when we have piped water, we are a bit sure of the kind of water that we are supplying to the healthcare facilities. In those that are connected with piped water, up to two-thirds, they report irregular supply. And this situation is really affecting the healthcare workers and patients. And if we speak patients, it is mainly affecting women and children, especially during labor and delivery. And only two-thirds of the healthcare facilities provide patients with access to toilets, and 44% and 42% respectively of healthcare facilities, consultation rooms and delivery rooms, they lack functioning hand washing facilities. We're still observing limited menstrual hygiene services on the facilities for female patients as well as staffs, and as well as the adolescent girls who are trying to access services from these healthcare facilities, but also the accessibility of the facilities for the people with disabilities is still questionable, not that much scaled up in the country. But we understand, despite of all these gaps, we still don't want people who are going to the healthcare facilities to get service to leave the facilities while they are sicker than when they entered the healthcare facilities. And if we are having poor WASH standards or at the healthcare facilities, it is likely that people may contact diseases at those areas. And if that happens, it even kind of discourages them accessing services in the next time. If we link WASH and reducing the healthcare cost and economic productivity, it is proved that investments in WASH infrastructure can lead to cost saving in the healthcare sector. And if we treat diseases caused by poor wash condition, we save a significant amount of money. It is highly expensive to treat the diseases related to wash. And by improving this access to clean water and sanitation, the healthcare system can redirect those resources toward other priorities. From one of the UNICEF reviews, it is seen that the estimate of 70% of spending that are kind of allocated for healthcare, they are directed to deal with preventable wash-related diseases, and we know we have a lot of them. So you can see if this is the number, or if there's any other review, it will not be not far from this. We still need to look at it differently to make sure that you're having savings that can go and service other areas. Also, when we have people who are healthy and not suffering from waterborne diseases or illnesses, they can be more economically active, and this can ultimately support mobilization of resources to direct into UHC from the individual level to the government level. And we see the pivotal role of poverty reduction and economic growth if linked with improved wash services at different levels. Next slide, sorry. No, the previous one? Yeah. From the recent reports by World Bank, if we also look at the economic lens in relation to wash, it is seen that the country is losing almost 5.6 trillion shillings annually, which is equivalent to 3.2% of the GDP, due to poor access of clean water and sanitation facilities. And it is even said that this estimate may still be on the lower side because there are some aspects which were not looked upon during this analysis. So this is a significant amount that can also be redirected to another areas. Next slide. But we look also at WASH in the angle of disease prevention, and it is proved that access to clean water and sanitation facilities is essential for preventing waterborne diseases such as cholera and diarrhea. For the diarrhea-related diseases, just by improving WASH, we get up to 36% reduction. And we see a good trend in the regions or areas with improved WASH infrastructures and services, where the incidences of reported waterborne diseases is kind of significantly reducing. At the country level also, the review shows that 31,000 Tanzanians die each year due to poor wash services. And this is 10.3% of all premature deaths that can be prevented just by improving wash. And we know if we prevent death, it means we get more people doing other economic activities, and in cities also impacting our economic growth as well. And proper sanitation also reduces diarrhea by 36%. I've already said that. If we look at an important angle of maternal and child health, we're also seeing access of clean water and sanitation facilities during childbirth and postpartum, how highly they are contributing to safer deliveries and better postnatal health outcomes. And we know if we get safer deliveries and safer postnatal health outcomes, it means even speaking about issues like sepsis, for both maternal and neonatal sepsis, we get a significant reduction. And the lack of availability of safe wash facilities during childbirth, they contribute significantly to poor health outcomes to both mothers and child. And newborn in low-income countries are at higher risk of morbidity and mortality from sepsis, and this includes also the women who are delivering the facilities poor wash services, especially when we come to the facilities that are providing EMOC services, the operative ones. But also, by just having wash, sepsis can be preventable, averting up to 1.4 million maternal and neonatal deaths each year. So we see how important also this aspect is. For the service delivery, The standards of water sanitation and hygiene management are crucial components, as well as said previously, for patient satisfaction and quality of care at the healthcare facilities. They do increase the healthcare seeking behaviors, but also they increase comfortability of the healthcare providers if they're providing services to patients. And WASH investment in healthcare facilities do enhance patient health outcomes, lower healthcare associated infection, and they boost the confidence and morale of both patients and healthcare workers. We know the country has not been quiet about this. There are several initiatives that are going. The importance is highly known. There are different avenues that are working, making sure that we are attaining sustainable wash services for our communities and Tanzanians. And at the national level, one among others that I'm just mentioning here, we will also see during the panel discussion other measures that have been taken. But we have the wash in healthcare facilities guidelines, which are already endorsed, and it is a remarkable achievement in the health sector. And these guidelines were prepared and realized through the coalition building and collaboration between partners and the government, and all of them looking forward to make sure that we are attaining sustainable wash and averting the mortalities, morbidities, and the economic impact that are coming out of poor wash services. So it is one of the notes of success in the wash sector. We are going to hear about others from the Ministry of Health representative as we go into the presentations from the panelists. So as we are going to this presentation or the panel discussion, we are still emphasizing on how equitable and universal health coverage access cannot be achieved without specific measures in WASH policy and programming to ensure that the healthcare settings are conducive enough for safe delivery and use of services to healthcare workers and patients respectively. We believe that investment in WASH in healthcare facilities is of paramount importance, and we wish to see rising standards beyond basic service levels and commit to specific actions to address specific WASH needs, especially for women and the most vulnerable population. We are looking differently at the lens of girls and young women and women at all in assessing safe water sanitation and hygiene services as a critical component to sexual and reproductive health and gender equality. Just from the few data, we see that a girl can miss 2 to 3 days cycle in a month, and in a year they can miss up to 40 days per year being out of school just because of missing the WASH services, and 17% out of school in the due period. And this is the population that we want to rise to make sure that they are making a positive impact in our economic as a country, as in turn contributing to the attainment of universal health coverage. So we know we have had several discussions from different panels and excellent suggestions that are coming out to improve universal health coverage, but less of which are discussing issues on WASH, which we wish also to be taken forward and looked upon in a different angle. And after the debates, who knows where the obligations or future obligation will be carried? Is it at the health facilities, at the ministry level, at the partner level, or where exactly are we going to make sure that we are taking forward these steps? So as we go into this important discussion, I would like to just quote one statement from WHO, which says a healthcare facility is lacking water, sanitation, and hygiene is not a healthcare facility, meaning it is not a safe environment for either the provider or the patients who are seeking care from that place. So next in the session, as we discuss more or further dwell into this matter, I would like to welcome our panel speakers who are really going to give us a hands-on experience, but as well kind of allude more on the interventions or initiatives that are going on at the national level, and how are we looking on WASH, and what is the call that we really need to look at in order to make sure that this is becoming a standing agenda as we speak about attainment of universal health coverage. So I will welcome my first speaker, Anita Mganga. Karibu Anita. Anita is a nurse midwife, and with over 9 years experience. She is currently working at Isanga Dispensary located in Bahi, Dodoma. Anita is passionate about her job as a midwife and is always excited to serve her patients with love and care. She's a champion of better services in healthcare facilities, and frequently she airs her voice on communities and leaders, and this has caught the media attention as of late. Karibu Anita. And our second speaker is Dr. Ezekiel Mbao. Karibu Dr. Ezekiel. Dr. Ezekiel Mbao is the president of TANA, and as of now, he is serving as a lecturer and holding the position of Dean of Faculty of Nursing at Herbert Kairuki Memorial University. With a career spanning over 13 years, he possesses extensive expertise in teaching, research, and consulting. His primary research areas encompass adolescent health, mental health, maternal health, and child health care. Karibu Daktari. And I would also like to welcome our guru, Engineer Herbert Kashila, who has been in the WASH sector for over 30 years. He is the founder of Shahidi wa Maji, a not-for-profit organization dedicated to support a fair water future for every Tanzanian. He has over 30 years supporting development of water and sanitation sector in Tanzania and in East Africa. He is currently the chair of water and environmental boards, including a chair of WASH Networks TowersNet and Water Resources Catchment Authority for Lake Rukwa Basin Water Board in Tanzania. He is advisor to African Network on Water and Sanitation. Karibu sana, engineer. And lastly but not least, I would like to welcome our representative from the Ministry of Health, Mr. Anitike Mwakitalima. Mr. Anitike Mwakitalima is the head of Food, Water and Environmental Sanitation, Environmental Health and Sanitation section from the Department of Preventive Health Services from the Ministry of Health. He has been working as a National Sanitation Campaign Coordinator since its first phase and was launched in 2012 and lasted in 2015. So he is the champion on that campaign. He made sure that it was taken forward and it was implemented successfully. The National Sanitation Campaign, among its intervention areas, is WASH in healthcare facilities, of which the government have invested a lot to support improvement of WASH infrastructure. Karibuni sana. So I will shift to the panel discussion and continuing to beg your attention. Thank you very much. Okay, we'll start our discussion, and we'd like to get our very first reflection from the grassroots level, and this is coming from Anita, who is the healthcare worker. Really, on daily basis, she's engaged in service provision, and for 9 years, she has a lot of experience when it comes to service delivery and how is it linked with WASH. So, Anita, as a healthcare worker, can you share with us the experience of working in healthcare facilities in the context where WASH services were limited? And what have been the consequences to you and your patients? And how does this make you feel? And what actions did you take to improve the situation? Karibu.
Habari. Naomba kwenda moja kwa moja kwenye jambo unalotaka kuzungumzia. Mimi kama mtu wa huduma nimepitia wakati mgumu katika ufanyaji kazi, hasa katika mazingira ambayo nilikwenda kufanya kazi, palikuwa hakuna chanzo sahihi cha maji katika kijiji, lakini hata katika mazingira yale ya kazini hapakuwa na maji ya uhakika. hivyo ikapelekea kuniweka katika wakati mgumu katika ufanyaji kazi. Sambamba na maji pia, hata ile miundombinu kama shimo la kutupa placenta hatukuwa nalo, shimo zuri ambalo pia ilikuwa nanipa wakati mgumu napomzalisha mama kutupa zile placenta. Lakini pia hata shimo ambalo tunatumia kuchomea taka kwa wakati huo halikuwa katika hali nzuri, na vyoo ambavyo tulikuwa navyo kilikuwa ni choo kimoja ambacho tunategemea kutumia wote wagonjwa na mimi mtoa huduma. Kwa mazingira kwa ujumla hayakuwa rafiki, na kitu ambacho kilikuwa kinanipa msongo wa mawazo na kutofurahia mazingira kwa ujumla. Na tumeenda katika mazingira hayo kwa muda mrefu tukijaribu kutumia mazingira kama yalivyo, huku tukijitahidi kutengeneza namna ambayo itatufanya tuwe comfortable. Na kwa bahati nzuri katika miaka yote tulikuwa tunafanya kazi, mwaka 2020 ndipo tukapata mdau ambaye alitusaidia kupata maji ya uhakika, japokuwa sasa hayakuingia ndani ya kituo, yakiwa tu nje, na mpaka leo yapo nje. Kwa hiyo angalau wametupunguzia ile adha ambayo tulikuwa tunaipata mwanzo, hususan katika swala la maji. Tulikuwa tunatuma mtu kwenda mbali zaidi kama kilomita 3 hivi, anafuata na baskeli au pikipiki atuletee, lakini ilikuwa inatugharimu kwa sababu hatakuwa na fungu ambalo kituo kinalo kwamba litatumika kwa ajili ya maji. Kwa hiyo tulikuwa tunatumia fedha zetu, na wakati mwingine ilitulazimu kuagiza ndugu waweze kuja na maji mara wanapokuja na mgonjwa, hasa mjamzito. Na kwa bahati mbaya sana maji ambayo tulikuwa tunaagiza ndugu yalikuwa ni yale ambayo ni ya visima, kwa sababu hatuna chanzo kizuri cha maji kwa wakati huo. Kwa hiyo ilikuwa ni maji ya kisima ambayo hata rangi yake haikuwa comfortable kwa matumizi, na ukizingatia tunafahamu katika sehemu za kutoa huduma za afya maji yanahitajika kwa kazi nyingi. Tunanawa mikono, tunaoshea vifaa kwa ajili ya matumizi, na kama unapoenda kuosha mtu kidonda, tunapoenda kumzalisha mama, tunatumia vifaa ambavyo vinatakiwa vioshwe ndivyo vichemshwe kwa ajili ya matumizi ya mgonjwa mwingine. Sasa yale maji hayakuwa mazuri, lakini ndio maji ambayo tulikuwa nayo na ilazimu tuyatumie. Kwa hiyo nimepitia kipindi hicho, ila mwaka 2021 tukapata hayo maji ambayo ni masafi ya kisima ambacho kimechimbwa kisasa na yamewekewa dawa, lakini changamoto ni kwamba hayako ndani. Kwa hiyo bado hatuna hata zile sinki za kunawia zenye ubora. Asante.
Asante sana Anita kwa that reflection. Na kutoka kwako labda ningependa kwenda moja kwa moja kwa Dr. Mbao ambaye amekuwa katika government level. Dr. Mbao, I understand TANA has been in the forefront on taking forward issues around WASH, and this is really meant to address issues like the one that Anita has just alluded, to make sure that the people who are working there are having also the comfortable environment. And I will say this has been one of your standing agenda. So as an organization that is representing nurses in Tanzania and having WASH as your standing agenda, how do you see the prioritization of WASH at the national level at the moment? Karibu Daktari.
Thank you very much, Dr. Happiness. And I'm really happy to be part of this panel discussing about we are the professional association. How do we see the prioritization of water, sanitation, and hygiene at the national level? So first and foremost, I would like to congratulate the previous speakers for a very nice presentation. And I would like to join my hand with them by saying that we as TANA, a professional association, we believe that prioritization of water, sanitation, and hygiene at the national level is crucial in improving healthcare service delivery and public health. Because without having the proper water, sanitation, and hygiene, it's very difficult for us as professionals to provide the effective health services. So water, we all know that water plays a fundamental role in preventing the spread of infection from one person to another, but also ensuring patient safety and creating a conducive environment that enables all the health professionals to provide a care which would reduce the spread of the infection, but also building the confidence to these healthcare professionals. Now, what is the level of prioritization of water, sanitation, and hygiene at the national level? Now, in order to address this issue of prioritization of water, sanitation, and hygiene, we need to remind ourselves about the Sustainable Development Goal number 6 and the Sustainable Goal number 3. These are the key Sustainable Development Goals which address the issue of water, sanitation, and hygiene. And we all know that without adequate water supplies, without adequate sanitation and hygiene, it is very difficult to achieve these two Sustainable Development Goals. Now, the previous speaker, Dr. Happiness, has just mentioned the current status that we are having here in Tanzania. And I don't have to go back again and repeating the same statistics that she has just pointed out. But what we believe that we as a professional association has a crucial role to play in order to improve the situation of water, sanitation, and hygiene in our health care facilities. We know that nurses constitute about 70% of the healthcare professionals. And they are the ones who are staying for quite significant amount of time with the patients, trying to provide care. And this care that are being provided by nurses and other healthcare workers is really important to be accompanied with the adequate water, sanitation, and hygiene. We have seen that this is a very crucial issue of prioritizing water, sanitation, and hygiene. Why? Because it's a public health issue, it's an economic development issue, but also it's an issue of poverty reduction. So in order to ensure that we provide a comprehensive care to our patients, we need to have adequate water, hygiene, and sanitation in our working environment. And our healthcare workers need to understand the role of water in the healthcare facilities. Now, if you look at the statistics, there are different literatures that are pointing out about how far the country has tried to do a lot of efforts in collaboration with the different stakeholders and implementing partners in trying to address the issue of water, sanitation, and hygiene in our healthcare facilities. Now, having said that, there are some initiatives that the government, in collaboration with implementing partners and donors and other stakeholders, has done in order to improve the issue of water, sanitation, and hygiene. The first and the foremost initiative that the government, in collaboration with the different stakeholders, has established a guideline for healthcare facilities in case of water, sanitation, and hygiene. And this guideline right now, as we speak, is available in almost all facilities. And our health professionals, including nurses and doctors, they are the ones who are using this particular guideline. Now, this guideline now gives a kind of direction of what are the minimum standards a healthcare professional needed to implement in order to to ensure that there is adequate water, sanitation, and hygiene in those healthcare facilities. The other initiative that the government, in collaboration with the implementing partners, donors, and other stakeholders, is also using the National Development Plan. The National Development Plan also has some targets that it tries to mention what are the kind of targets we need to achieve when it comes to the National Development Plan. And this is also being implemented in all healthcare facilities. And apart from that, our government, again, through the Ministry of Health, has participated in various global initiatives in order to provide quality healthcare services to pregnant women, children, and neonates. And by doing so, we have a number of initiatives. One of that is a coalition of the initiative whereby there are 9 countries, including Tanzania, Bangladesh, and Uganda, whereby these countries has been monitored by UNICEF and WHO in implementing these initiatives of applying different initiatives in improving the quality of services for mothers and children. But apart from that, the government, in collaboration with the different stakeholders, has initiated a communication strategy for infection prevention and control in order to make sure that we all know that in infection prevention and control, water is necessary. There's no way that we can do IPC without having adequate water, sanitation, and hygiene. So looking at these strategies that the government, in collaboration with the different stakeholders, has done, we have managed to reduce the number of deaths for pregnant women and even for neonates. If you look at the current statistics of the maternal death in Tanzania and even the neonatal death in Tanzania, it has significantly reduced. So, however, we are not there 100%. We still have a long way to go in order to ensure that we have addressed the goal number 3 and goal number 6 come to the year 2030. And there are a number of challenges that are there. And the government now, in collaboration with the different stakeholders, donors and partners, still have a long way to go in reaching the standards that we would like to see, that there is a universal access to water, sanitation, and hygiene to all of our health care facilities. Now, to mention some few challenges that we are facing, we still have a very low budget when it comes to issue of water, sanitation, and hygiene. So this is one of the challenges that the government, in collaboration with other stakeholders, are still facing in addressing the issue of water, sanitation, and hygiene. But also, we have the issue of climate change and the population growth. These are some of the issues also kind of pulling back the efforts of ensuring that we are attaining the goal number 3 and goal number 6 as far as the sustainable development goals is concerned. Thank you.
Thank you very much, Dr. Mbao, for that very insightful discussion. and points that you are bringing, and I think they are connecting very well with our next speaker, Engineer Herbert. Being in the field for over 30 years, I think you have seen it all, and you know where we are coming from and where we are going, at least where we are right now, but the wish of where we really wish to be, and looking at the SDGs. Linking from what Dr. Mbao has just said regarding the challenges, among others, that she has spoken, and knowing the role that THS has. Dr. Mbao, at THS, you are representing more than 60 local actors in WASH, in a space who play, and you are playing an oversight role to ensure there's check and balance on WASH sector investment between the government and other players. Looking at the challenges also that have just been alluded, being some of the existing, if you were to speak maybe to the Minister of Health or the President and highlight just 3 key points about the situation that has been addressed by Dr. Mbao and Anita there, the points that you will critically like them to take forward and that you really think they can bring at least a certain change in the WASH sector if we relate it to UHC, what could have been your advice?
I hope wote tunaisikiliza Kiswahili, hamna ambaye lugha yake ni ya kigeni. So if and a few of you are not able to follow in English, unasema major problems are discussed in our mother language. Si ndio jamani, eh? Okay, niseme asante sana Happiness, na swali lako gumu inategemea waziri au rais nimekutana naye wapi. Nikutana naye kwenye lift, mazungumzo yako tofauti. Lakini nikikutana mara nyingi siwezi kukutana na rais sehemu ambazo hazihusiki. Itakuwa ni platform ya kisiasa. So ikiwa platform ya kisiasa na maneno yangu yatakuwa ya political right, lazima niyazungumze hivyo. Na unajua kwa kwetu Tanzania atakuwa rais Mswahili, anajua Kiswahili. Na kwa changamoto ambazo nimezisikia na cause nazifahamu, I trust, naamini na wengi mnazifahamu kwamba tuna shida ya changamoto kubwa ya upatikanaji wa maji. Na hasa wale mnaokaa Dar es Salaam, mkiniambia mnapata 24/7 365 days maji yasiyo na tatizo, nitakuwa na shangaa. Labda kama wewe unakaa karibu ya linapopita bomba. Kwa hiyo moja ya kimsingi ni kwamba kabla sijaendelea kwamba maji is a human right. Sijafahamu vizuri dokta kama afya pia ni human right, eh? Okay. Sasa unaangalia vitu viwili. Water and wash is ni human right. Kwa hiyo kwa rais ambaye huwa kwa Tanzania ana mamlaka makubwa ya kisera na ya kifedha, moja tu nafikiri mmeyasikiliza hapa kwamba hela hazitoshi na hazitatosha, na ni wangu kule mwisho akazungumza kabisa, wamekaa miaka mingi sana mpaka wapata mfadhili, sio hela ya serikali, wapata mfadhili mwingine. Kwa hiyo ni muhimu kumchechemua rais kwamba tunahitaji uwekezaji mkubwa sana wa kifedha kama tunataka kufikia malengo haya ya haki za binadamu mawili makubwa. Haya mawili makubwa. Na bila hivyo hatuwezi kwenda mbele. Lakini nikipitia takwimu zangu ambazo huwa nazifahamu mimi hapa, mapato ya serikali mara nyingi huwa hayatoshi kukizi matamanio yote. Hata siku moja sijawahi kuyaona. Kwa mfano bajeti ya Wizara ya Maji, kwenye programu ya taifa ya maendeleo ya maji, Water Sector Development Program, ina fezi 4 ambayo ilikoenda kwa miaka 20. Sasa hivi tuko kwenye fezi ya mwisho. Lakini we have never got all the money, to be honest. Katika miaka yote hiyo tumepata only 48% commitment. 48%. Na 48% ikija tunasema ni commitment. Kwenye matumizi mara nyingi hazitumiwi zote. Sasa uangalie hiyo picha ya namna gani tunakuwa na changamoto. However, unaona hizo progress zinaonekana zinaendelea. Kwa mfano sasa hivi watu wanaopata maji safi na salama vijijini iko kama 72%. So around watu milioni 16, milioni 20 hivi hawana kabisa hayo maji ambayo tunayazungumzia, which means hata kwenye hivyo vituo vya afya vya kwetu, we would call health facilities, maji hayawezi kufika. Na kama hayawezi kufika, na maana kuna changamoto ambazo daktari hapa amezungumzia na nurse kule kazungumzia. Lakini nikizungumza na waziri huwa tunakutana naga na wao tunakutana naye platform nyingi tu, nitamwambia yote ya ukweli kama yalivyo ya ukweli. Moja, swala la kisera. Sera sasa hivi ya wash ziko tunasema fragmented, kuna ya maji alafu kuna ya public health. Lakini ukizungumzia swala la sanitation huelewi iko upande gani, au hygiene. Watu wengi sidhani kama mnaelewa hygiene maana yake nini, iko upande gani. Kwa hiyo swala la kisera, usipokuwa na sera kawaida huwezi kutunga sheria ya fedha kama hamna sera. Kwa hiyo ni uzuri kwa waziri ni msukume katika mfumo kwamba tunahitaji kuwa mazungumzo ya kutengeneza sera iliyopo. La tatu ambalo pia litakuwa la waziri kwa sababu rais tutamwambia la kifedha ni swala la sustainability. Ukisikia hadithi nyingi hapa kwamba maji yanafika yanaonekana yapo, lakini uendelevu wa huduma unakuwa very poor kwa sababu mifumo yetu, our system ya management ya health facilities bado ni government led, yani serikali italeta ruzuku tujenge choo, serikali italeta ruzuku tujenge isinileta, serikali italeta tulipie gharama za maji. Hiyo haitatokea. Nafikiri hapa katika hatua hii tunahitaji kuwa na mabadiliko makubwa, tunaita radical changes kwenye huduma zinavyotokea. Kwa hiyo hii ni kumwambia waziri. Sasa waziri akipata hiyo, kawaida yeye ana utaratibu wa kutengeneza marejeo na mazungumzo na taasisi yake. Nafikiri mimi maswali yangu yalikuwa hapa ya juu, sitaki kuongea detail. Nafikiri that is. Asante.
Asante sana engineer. That was really insightful and straight to the point. And now I would like to go to Mr. Anitike in the place of the Ministry of Health. After receiving the reflections and hearing the reflections from the service provision level to the others who are working at institutional level, as you are representing the ministry, why do you think that water, sanitation, and hygiene in healthcare facility is important for achieving universal health coverage objectives? And I know Dr. Mbao has kind of highlighted some of the initiatives that are currently existing, but if you can also share more that are there in place to accelerate, because right now I think you're speaking about the acceleration, trying to see what we'll be able to catch by 2030. So if we can get a reflection about that from you, Karibu.
Hello. I think it is good afternoon. Eh? Yeah, still morning. Good morning. Yeah. First of all, I would like to commend a very good work that has been done by our partner, WaterAid, to convene this important session on WASH in healthcare facilities. You can imagine throughout the summit, this is the only session that talks about WASH. So we commend that step that you have taken. And also I would like to commend the contribution from my fellow panelists who have shared their views on what is happening on the ground. We have heard from Madam here, Dr. and Engineer Kashirila, who are the experts in this area and have been working for quite a long time. Yeah, for us as Ministry of Health, really, and when it comes to the concept of universal health care, we say WASH has no alternative. We have no alternative for water, no alternative for sanitation and hygiene. the same as healthcare waste management. These are crucial and very important. And when we are talking about the universal healthcare coverage, there are three pillars, if you wish. We are talking about quality services, we are talking about equity and dignity. You cannot talk about quality if WASH is not considered. Also, Dr. Bao here talked about the maternal deaths and neonatal deaths. If you read literature, very recent publications shows that among the leading cause of maternal deaths in the developing countries is something to do is to PPH, hypertensive disorders, and number 3 is WASH. When you talk about maternal sepsis, it's something to do with inadequate WASH and IPC issues. And you cannot guarantee IPC if you don't have water. So, as a government and being aware of the importance of WASH, we have taken some initiatives. One of it is that before 2017, in the country, we had nothing called guidelines for WASH in healthcare facilities. So in 2017, that's when the country developed the first guideline for WASH in healthcare facilities. And we all know the importance of guidelines because it sets standards on what is required. And it was not only the situation in Tanzania, but across, you can imagine in Africa. By the time we are developing the guidelines, we had to do consultation to our neighbors, Rwanda, Uganda, Kenya, Zambia, all the countries which are surrounding Tanzania. We couldn't find one. The only country that had guideline by then, it was Ethiopia. And actually that was not a guideline, it was a manual for water supply mostly. So we are among the first countries in Africa actually to have our own guideline. And we have shared widely to our fellows and some have adopted it. And apart from the guideline, we also developed tools because having a guideline is one thing, but we also have the tools to operationalize the guideline. We have developed the designs for water supply for our healthcare facilities. Imagine in the previous, especially in the primary healthcare facilities, a facility is constructed but without any consideration of water. The structure is there, but no water. Madam has talked here. She has been working in a facility for so many years, but the facility had no water at all. Okay? Now, after developing this guideline and tools, the government now has come up with a program to improve WASH in our facilities. We started this program in 2019, and we are targeting to achieve around 2,636 healthcare facilities, and these are primary healthcare facilities, meaning dispensaries, health centers, and district hospitals. And to date, as I speak, we have reached 1,903. And by end of this financial year, we are expecting to achieve the 2,600 facilities. And we still have some 2 years to finish this program. So our focus is to see into it that all rural healthcare facilities where the problem is big have improved access of water, toilets not only for the staff, toilet for everyone, for staff and for the clients, and also for the people with disability. All our facilities now, which are being constructed, are required to provide facilities for people with disability. Okay? And some of the rural councils have already achieved the universal coverage of WASH. When you talk about Sengerema, we have reached the universal, all the healthcare facilities in Sengerema. Okay? Talk of Mufindi, talk of Mbozi district, and several others. Okay? It's unfortunate that Dodoma region has entered into the program this year. So we'll check the name, and because the guy from Porage is also here, Sariman, we are going to deal with that facility to make sure that we do the plumbing so that water is available at every point of care. So these are some of the initiatives that really the government is taking. And as a matter of budget, we have, the government has allocated enough money, at least I can say, for the past 5 years. You can imagine washing healthcare facilities has received around 240 billions Tanzanian shillings. And this is the money that has been committed and is available. Like Engineer Kasiria said that there are two things, having money in the budget and having money for the implementation. What I'm talking here, I'm talking about the money which is available, okay? And we have already used it in 1,903. And for this year, we have planned to go into 729 healthcare facilities. And we expect by 2025, at least all healthcare facilities will be furnished with the improved water supply and sanitation hygiene. We have a challenge, yes. While dealing with the rural, urban also, the problem is growing up. So the focus now is to turn up again to look on what to do in urban areas, because much of the efforts that we have now from the government side actually has been skewed toward the rural areas. So we will keep on improving as we go, and by 2030, the vision that we have is to see into it all our healthcare facilities have improved wash services as per World Health Assembly's resolution number 72.7 of 2019. Thank you very much.
Thank you very much, Anitike, for the numbers as well, because you have spoken with examples. More than 1,000 healthcare facilities being covered. It is not a joke. It is a big work that we can vividly see, and we are seeing as we are visiting the facilities, and we can really compare where we are coming from and where we are. Just wanted to have a quick follow-on question to Anita. Since you have been in two situations, when the facility didn't have water, and then you reach the time when you have water, regardless that bado maji hayajaingia ndani lakini yapo. Unaonaje pale kituoni ukilinganisha kipindi ambacho hamna maji na yalivyokuja, labda kiwango cha kina mama wanaojifungua, watoto wanaorudi labda kwa kupata zile infection, unaona kuna utofauti wowote? Karibu.
Asante. Ya, utofauti upo na ni mkubwa, kwa sababu kama tunavyofahamu maji yana msaada mkubwa sana katika vituo vya kutoa huduma za afya wa kukinga na kuzuia magonjwa. Tunapokuwa na maji ya uhakika inatusaidia sisi kuweza kuzingatia zile kanuni zote muhimu za kutakasa vifaa, za kuweka mazingira safi kwa ajili ya kuepusha mlipuko wa magonjwa ambao unaweza kutengenezwa ndani ya hospitali. Kwa hiyo baada ya kupata maji kwetu imeturahisishia hata katika utoaji wa huduma na kuweka mazingira safi na kupunguza zile contagious infection ambayo tunazizalisha mle ndani. Kwa hiyo kiasi cha magonjwa ambayo yanasababishwa na uchafu kimeshuka kidogo tofauti na hapo mwanzo. Ndio.
Asante sana Anita, and I think with that it is just a simple example showing how we can easily omit some of the infections resulting from the healthcare facilities, and also give comfortability to the patients and service providers as they receive safe and clean water nearby or into the service delivery points. And maybe I will follow on with a brief one also to Dr. Mbao. We have heard from also Anitike. He's speaking about the facilities that are there have been improved in the plan that we are having by the end of the year and by 2030. We have also seen in some of the areas where you will find all these facilities are provided, but you face the attitude issues to the healthcare providers. They will facilities will not be cleaned. I think the training on IPC that you are speaking about is also still an issue. The attitude sometimes is an issue, and you may find you have very nice facilities which either are underutilized or not utilized or not maintained. You, Tana, being as an umbrella organization overseeing our healthcare providers, do you have any initiative that can be used to make sure at least there are engagement platforms or continuous learning to make sure that whatever that is being provided is translated into the service delivery? Karibu.
Thank you very much, Dr. Happiness, for that question. We, as a professional association for nurses, one of our core objectives is to ensure that nurses are providing health care according to their standards. And these standards actually are being set by the Tanzania Nurses and Midwife Organization, Association. But now, for us as a professional association, is to advocate for that issue of behavioral change. Now, we know that one of our big challenges is that we have a lot of members that are practicing in the healthcare facilities. And it's our main objective to make sure that our nurses have adequate knowledge, but not only having the adequate knowledge, but also have the behavioral change. Because we all know that when we are teaching our nurses or in the teaching, there are 3 domains that we need to address. The first one is the cognitive part, and the second one is the skill part, and the third one now is the behavioral aspect. Now, of all these 3 domains, the first one of the knowledge and the second one of the skill, that is the easy part. But one of the most difficult aspect to transfer to a student, always, it has been the third part, which we are talking about, the attitude and behavioral change. You might take a cow to the river, but you cannot force the cow to drink the water. Now, this is one of the challenges that we are facing, and there is a continuous advocacy that we are doing to our nurses to raise the image of the profession by providing the services that is acceptable to the client and to the community. So I think we agree that we still have a long way to go on transforming the profession, especially when it comes to the third domain of learning. And we will always keep on striving to make sure that we are taking the profession to the level that the service delivery is of standard, but also acceptable to those who are receiving that particular services. Thank you.
Thank you very much for that, and I will agree less. And I know there are initiatives right now of kind of having a behavioral change package for healthcare facilities, at least to help the healthcare providers to make use and to change their attitude when it comes to service provision, and WASH is also the aspect that is being looked upon. Engineer Herbert, maybe a follow-on from what you have highlighted regarding the budget and the amount that we've been able to get to date, and what Yanitike has just said regarding the amount of money that you're having. I know we have different aspects here. We are speaking about water, we are also speaking about sanitation, but I just wanted to get you a general impression. If you look maybe in the past 5 years or 10 years, how is the trend of the budget? Is it kind of, as much as we are not there, but is it the allocation increasing like each year, or do we see the gap is increasing? How is it really? Karibu.
Yeah, just ni reiterate kwamba alichosema Nyitika iko correctly. Tuliokuwa kwenye sekta muda mrefu, sanitation ilikuwa haipati. Yani ilikuwa kama vile mtoto yatima. So there's major progress been done, na ndio maana wakinanyitika wanaweza kusema wako comfortable, things have been seen on the ground. Lakini huko zamani ilikuwa ni kugombana tu. So hiyo nyingine niliyozungumza budget ni kidogo, hii ni ile sekta nzima na program ambayo kama matamanio yetu yangetufikia huko tungekuwa tukua vizuri sana tunge accelerate, lakini wote mnajua hatuwezi kuachieve zile SDG 6, tuko behind. Sawa, kwa sababu tuko behind ni kwa sababu ya finance. Moja kubwa hapo ni finance tu. Lakini ukiangalia kwenye miongozo ya kupanga na kuallocate resources, tulikuwa najiuliza sisi wengine kwa sekta, criteria ipi inasema uipe Wizara ya Afya how much against ile national budget? Huwezi kuiona. Hata ya maji leo utasikia wamefuata 44 trillion, mwaka ujao utasikia 20 billion. Unajiuliza criteria ikoje? Kwa hiyo kidogo undefined, na unaweza kuiona tu kwenye zile outcome indicator. Watu wangapi wanapata huduma ya maji, watu wangapi wako kwenye access kwenye sanitation and hygiene. Hizo ndio zinakuashiria kwamba we are making progress. Commitment ipo. There is a commitment kwamba tunapenda kufanya hivyo. Lakini sisi wengine tunaangalia kwa juu, sometimes revenue ya serikali huwa sio nyingi ya kutosha kukidhi matamanio ya sekta zote. Sasa tunapigana, kwa mfano sisi TAWASA tunapigania kwamba sekta muhimu, afya, elimu, maji, ziwe ni priority sector. Kama priority sector, maana yake indicator ya planning iwe very clear kwamba tutatoa a certain percentage against our GDP annually ili tuweze kuachieve zile aspirations zetu. Na unajua maji ya afya ni ukifanya ni kama unakuwa mtakatifu, si ndio jamani? It's a holy duty. Sio tu mnafanya, it's a holy duty. Nafikiri ni muhimu tukawa tunaiona kwa picha hiyo. Asante sana.
Asante sana. I will get to Anitike later, following the time. We have 10 extra minutes, I know, from when we started. Chaz, is that correct? Okay. Okay. So maybe I'd like to give the floor to the audience to see if there's any reflection, comment, or question. And as you are addressing the panelists, I really appreciate if you'll mention the question is addressed to who, so that you get clear kind of answers. And we'll also love to know your name and where you're coming from. Karibuni sana.
Hello. Nashukuru sana. Naitwa Innocent Deus, natokea Tanzania Summit, ndio General Manager Tanzania Summit. Tunashukuru sana kwa discussion nzuri. Tunasema kuna changamoto moja kwenye sekta ya maji. Moja ambayo ni kubwa ni sustainability, kama ambavyo engineer Herbert Kashiria alivyosema. Changamoto inaanzia kwenye system nzima ya usimamizi, kwanza kwenye provisional and also supervision of the of the water facilities. Previous tulikuwa tuna water village committees ambazo zilikuwa zina uwezo wa kusimamia facilities hata ambazo ziko kwenye health centers, lakini baadaye tukazitoa tukaleta KOWOSU. Lakini unakuta KOWOSU ina combine more than 3 to 4 villages. Unfortunately, katika vile vijiji unakuta kuna vijiji vitatu havina any water sources ambayo iko improved, any water facilities. Kwa unakuta yani wanakosa nguvu ya kupeleka, au wanakuwa hawapeleki nguvu kubwa kwa sababu wenyewe hawana chanzo cha maji. Kwa hapo ndipo ambapo tatizo limeanzia. So kwa sababu tuna watu wa wizara nadhani upande wa afya we have what we call health system strengthening, right? I think the same model can be used katika wash system strengthening, ambayo inaanzia from the water facilities, so that watu waone kwamba they are accountable and they are responsible to make sure that the water facility is working 24 hours. But also there must be a person who is well trained to repair that facility. We should not wait for more than 48 hours after baada ya kile ya water facility kwa imeharibika. So let me stop here for the sake of time. Thank you.
Thank you very much. I have the question that I will address to Anyetike and Ania. As far as universal health coverage is concerned, that is enabling every individual to access healthcare services without any financial difficulties. And actually, when we talk about access, we mean both like physical access as well as social, cultural access, which has to deal with issues like acceptability. So I was asking Anita, in his work, issue a wash, how does it affect the access in terms of cultural acceptability as a healthcare facility? By then was having an improved sanitation, hygiene, as well as no actual water supply in the place. With reference to your work, I know you are Mkunga, in your part of maternal and child health, particularly on issues of delivery services in your facility. How does it, how the access was affected by absence of those services? And in general, then I think I would like to elaborate a little bit in terms of access to healthcare. How WASH, according to the experience and different evaluation you have been doing throughout the country, how does it affect? And another question I direct also to Anyetike that universal health coverage is also has to deal with addressing issues of inequalities and equities. That is to ensure inclusion toward accessing the healthcare services. As far as WASH is concerned, how these issues of inequalities within the communities, the inequities have been addressed through the WASH program we are implementing, so as we can ensure that like no one is left behind. In terms, for example, we said among the initiative was like development of guidelines and whatever. So we want to know also in that area. And one question is on Kashilila. The way you are explaining is like it is very difficult, like the health sector alone, to achieve universal health coverage, because there is a need like collaboration from other sectors and the partners. So what do you think that will be the appropriate way to coordinate different sectors to engage toward facilitation of universal health coverage by 2030? Lastly, among the challenges which are really causing the financial catastrophic to patients as well as their cares in healthcare facilities is hospital-acquired infection and the antimicrobial resistance, in which among the causes, WASH is one of them. Because the people are going there with certain diseases, then as they are admitted within the healthcare facilities, they're acquiring other diseases. So what the government actually is doing, Anyetike, Minister of Health, to address this challenge, because I see it will be a barrier toward accessing universal health coverage. Thank you.
Yeah, it's still morning. Good morning, everyone. I am Rita Mtayoba. I work with AMREF. My question will go to Mwakitalima. First of all, I'd like to congratulate the panelists for the well-placed discussion. I just have one. I would like to understand more about the program that is ongoing to improve WASH facilities. And I'm curious to know how the program has taken into account the current crisis in climate change to ensure green smart intervention are taken into account for water security, as water, we know it's a scarce resource, and given the climate change crisis, probably going to be depleted very quickly. So I'd like to understand how the program has incorporated green smart interventions. The other question also to Mwakitalima, I'm aware that within the Ministry of Health, we have the Quality Improvement Directorate that is overseeing the IPC initiatives. The few interactions that I've had with the IPC team, and for some of the program or initiative that we've worked together, even in the technical working groups, I've rarely come across the WASH experts. I know the two are marrying one another. You cannot do IPC without WASH. I just want to understand how the collaboration is because the efforts of WASH and IPC, they can really bring a significant impact in improving the healthcare provision. Thank you.
Thank you. We have seen other hands, but because of the time, if we can please address these ones, and we can have a bonus question if time allows. Karibu.
Mine, a gentleman called Innocent, aliuliza sustainability, ambayo it guarantee provision of water in a community systems, which will guarantee provision of water to healthcare facility. Sawa. Kwa hiyo hospitali ya Temeke hapa kama DAWASA hamna maji, na maana hospitali ya Temeke itakuwa haina maji. Kwa hiyo ile mifumo ambayo inatakiwa iwepe ihakikishe maji yanafikia watu wote hao. Sasa yeye alizungumzia kwenye management system ambazo ziko kwenye kisheria na kisera. Akazungumzia zile za vijiji, kama kutoka kijijini siku hizi imebadilishwa, kuna KOWOSO ambazo ni entity zinazowezwa kushtaki na kushtakiwa. Zile village water committee ilikuwa ni kamati ya kijiji ambayo iko chini ya mamlaka ya serikali ya kijiji, lakini walikuwa wanazikula hela sana wale miaka ile, na ndio maana hitaji la mabadiliko litokea hiyo. So, kwa hiyo wanazungumzia kwamba labda hii health strengthening system sijaifahamu mzuri, inaweza ikatumiwa kuimarisha hizi taasisi za huduma za maji, nafikiri nyingi vijijini, kwa sababu miji yote mikubwa, miji au makao makuu ya wilaya wana utility, na hizo utilities zinakuwa govern na EWURA. Kwa hiyo hili hatuwezi kutumia modelo hii. Modelo aliyozungumzia Innocent ni ile ya vijijini. So ni wazo zuri amelizungumza, lakini linahitaji liende kwenye meza ya majadiliano ambayo inabidi ubadilishe sheria ya sasa hivi ilivyo, ambayo inasema KOWOSO ni kama ka utility kadogo ka kijiji au vijiji, watu wanaotumia huduma moja. Siku hizi wanaita CBWOSO, sio KOWOSO, CBWOSO. Kwa hiyo ni wazo zuri, na nafikiri itafaa kama wazo hili liletwe kwenye technical working group ya Water Sector Development Program, ambayo mara nyingi huwa wanapata mawazo mapya, mawazo mbadala ya kuboresha huduma, na nafikiri wenye mamlaka RUWASA wana uwezo huo wa kuchukua hiyo kitu. Asante sana, ni sifupi.
Asante sana engineer. I think tulikuwa na swali lingine, nianze na Anita kabla ya Anitike. Anita, ulisikia swali kutoka kwa Selemani? Yeah, karibu.
Asante kwa swali zuri. Katika utoaji wa huduma nikiwa kama mkunga, ukosefu wa maji ulinipa athari pia katika utoaji wangu wa huduma, hasa kwa watoto, kwa maana ukosefu wa maji unasababisha hata mazingira nilisema mwanzo yanakuwa sio salama katika utoaji wa huduma. Kwa hiyo watoto wengi walikuwa wanapata infection kwa sababu utunzaji wa watoto, mama mwenyewe maji ya uhakika hana. Kwa wanaporudi nyumbani wanarudi watoto wengi na infection hasa ya macho, infection za kitovu, lakini hata katika ngozi. Lakini sambamba na hilo, kuna baadhi ya wakina mama pia wakawa wanapata infection kwa sababu kutokana na ukosefu wa maji walikuwa wanashindwa kujisafisha vizuri katika miili yao, na kama tunavyofahamu kuna akina mama tunawashona, lakini pia mama anapojifungua anaendelea kutoka damu kwa siku kadhaa. Kwa hiyo kwa kutozingatia usafi, kwa kukosa maji ya uhakika, mama alikuwa anarudi pia kwa sababu ya infection. Lakini changamoto nyingine ambayo ilinikuta ni wajawazito walikuwa wakijifungulia nyumbani. Kwa sababu gani? Kama nilivyosema mwanzo, tulikuwa hatuna maji ya uhakika na ililazimu mama anapokuja aje na ndoo ya maji kwa sababu hatuna namna nyingine. Kwa hiyo kuna wale ambao wanakaa mbali zaidi na kituo cha kutoa huduma za afya. Kwa mama anawaza aje na begi la nguo, aje na beseni na bado tuna aje na maji. Kwa hiyo tulipoteza pia baadhi ya watu kuja kujifungua katika kituo cha kutoa huduma za afya. Na nje na ukunga pia ni muuguzi, kwa hiyo tunafanya zile shughuli nyingine za uuguzi. Pia tupatia wagonjwa wengi wale magonjwa ambayo yanasababishwa na ukosefu wa huduma za maji na usafi wa mazingira kama kuharisha, ikiwemo kipindupindu. Tulipata mlipuko wa ugonjwa, kwa hiyo tukawa na changamoto pia ya kupata wagonjwa wa aina hiyo kutokana na kutokuwa na maji ya uhakika na kutokuzingatiwa kwa kanuni bora za usafi, kwa sababu miundombinu ilikuwa inachangia. Lakini pia tutana na changamoto ambayo kwetu ilikuwa ni msongo wa mawazo, kwa sababu hatuna mazingira safi na salama ya kutoa huduma. Lakini na wagonjwa pia walikuwa hawaridhiki na huduma. Akija kituoni anakuta tayari mtoa huduma ni na msongo, mazingira sio supportive. Na yeye pia hata mazungumzo yetu, hata yetu mazingira hayamfurahishi. Kwa hiyo kutoridhika na huduma kwa wagonjwa kulikuwa kukubwa sana ukilinganisha na sasa hivi ambapo tuna maji. Kwa hiyo tumepunguza kwa kiwango kikubwa zile infection kwa watoto, kwa akina mama, na hata ile uridhikaji wa huduma kwa wagonjwa na wakina mama pia kujifungua katika vituo vyetu. Kituo changu umeongezeka. Mwanzoni walikuwa kwa wiki kati ya wamama watatu walikuwa wakijifungua nyumbani, saa nyingine 2 wanajifungua kituoni, lakini sasa hivi angalau tunapata hata mama 4 kwa wiki ukilinganisha na hapo mwanzo. Asante.
Asante sana Anita. I think nitaenda moja kwa moja kwa Anitike. Ulikuwa
Yeah, thank you very much for...
you can be brief as well. Tuna kama dakika 3 hivi.
Okay, yeah. Thank you. Okay, question from Yondu from Porach. I think the issue of accessibility of healthcare facilities versus the provision of adequate wash has been spoken here by almost all the speakers. Once you improve wash, it means you are improving the levels of cleanliness in the facility. And this is one of the things that triggers people to go to a particular facility and not the other one. Recently, we have been visiting regions as part of supervision just last week to see how improvement of WASH has triggered access to our healthcare facilities. Just as Anita said, we have noted that majority of women now, the pregnant women, goes to our healthcare facilities for deliveries because the infrastructures have been largely improved. Okay, the issues of antimicrobial resistance also has a direct relation to WASH. So once you improve WASH, it means you are in a way dealing with issues to do with the antimicrobial resistance. The question from Mutayoba from AMREF. Yes, the issue of climate change has been taken into consideration. And in our program, one of the things that we are doing is to exploit all sources of water. You know, due to climate change, the level of salinity in the groundwater has increased. So groundwater is no more, in most parts, effective for our healthcare facilities. So we are resorting into other sources, including the surface sources and the rainwater harvesting. Okay, majority of the areas in our country receive at least rain in a period not less than 4 months. So we are exploiting that source to be the source of water supply. The issues of IPC and WASH, yes, we have these two which are coexistence. We have the IPC team at the ministry level, as well as WASH, and we are working together. And when it comes even to developing the guidelines, the standard operating procedures, because we are sharing issues between them and us, so we are collaborating. Otherwise, thank you very much for your contribution. Thank you.
Asante sana. I would like to thank all the panelists for a brilliant discussion and everyone who was able to attend this session. And I think we are leaving this room with a very good message on how WASH is important in improving the service delivery at the healthcare facilities, reducing preventable deaths, but also adding into our economic gain as a country. Thank you very much for listening, and thank you to the panelists.
Thank you so much, Dr. Happiness and your panel. A big thank you to WaterAid for preparing this session, and to you, the audience, for being part of the conversation. We're doing